Okay.
So today we are here with Jordan Barnett. He's an MD and an MBA. He also has a lot of other very impressive degrees. He's been the director of a lot of very important medical responses, both in in New Jersey and in the surrounding regions. Jordan we're very lucky to have Jordan today for a few reasons. One is that he is not only an emergency medical doctor who's heading into the front lines of the COVID response in New Jersey, he also has directed a bunch of emergency medical service operations in the area and has done important trainings for our hospital systems and for our emergency response teams. There's a few questions that we're going to ask Dr. Barnett, and I think that his message is going to be very important for the World Merit audience. So we're very excited and grateful to have Dr. Barnett here today. So Dr. Barnett, before we begin, can you just fill us in a little bit about your experience in emergency and medical response? And then we'll jump into some more personal questions and some messages that you may have for young people in the developing world in World Merit.
All right. Well, again, pleasure. Thank you so much for having me. Well, first off, my background, I actually used to work with New York City EMS, New York City Emergency Medical Services. I'm a board-certified emergency medicine physician. I'm currently working for a hospital system, which is a suburb of Philadelphia in southern New Jersey, southwestern New Jersey to be specifically. I'm also a medical command physician for a large suburban EMS system in the same township. I'll actually correct that. It's actually, it's the same township. My apologies there. Mm-hmm. We cover about 42,000 people and about 25 square miles, and also two major highway systems. I'm also an educator for two regional EMS training facilities, and I have a consultant company which helps with municipal and private EMS education and management.
Yeah, so needless to say, you really understand the needs of large populations in times of emergency, which I think is particularly important right now as we are facing this pandemic. There's another important thing I think the audience should know, which is that tomorrow you are heading into the front lines yourself because you're an active emergency medical physician.
Actually, I'm heading in at 12 o'clock today.
Wow.
Yeah, so the unfortunate reality is the turnaround time for the COVID testing, the coronavirus testing, is not as swift as some people would have you believe. Many facilities are having turnaround times as long as 8 days. Certainly some of the facilities I'm working in, that time frame is extending into 4 or 5 days.
And when you're saying turnaround times, you mean in order to get the result of the test takes 4 to 5 and up to 8 days?
And that includes our own colleagues. I have two physician colleagues. Fortunately, one turned out to have influenza, but the other one is currently out. He spiked a fever and he's been pulled from the schedule. The net result is I'm being a pitch hitter. So I'm coming in today at 12 o'clock to cover for him. But even for our own, we can't find out in short of 4 days, at the very least, to know whether or not they too are potentially contagious and have contracted COVID-19.
Yeah. Well, Dr. Barnett, thank you so much for your time, recognizing that you're going in today into the front lines. The work that you do is absolutely critical, and us around the world, we admire your true heroism, despite the fact that we know you are a doctor and this is your duty. For us, it means life or death. So thank you very much.
I'm happy to help. And, this is what pretty much all of us in healthcare have signed up for. So right. I'm happy to help out.
So we understand that there is a personal experience and then a direct message to the youth that you think is particularly important at this time for us to recognize. So I want to jump into that.
Sure. Yeah. So I'm going to go into something a little personal here, and I apologize for that, but it is one of the reasons why I agreed to interview. I understand that your audience brainstorms and comes up with ideas to help with issues that are affecting the world at large. And while this is a bit personal, I'm not the only unique individual who has this or similar circumstances going on. My mother died November this past year, not of COVID-19, of something completely different. But I have an 82-year-old father My 82-year-old father has cardiac disease, lives about 122 miles north of me in New York State, actually just in the suburb of New York City, and he's socially isolated. The issue is, well, can I come up and visit him? Well, the reality is we don't even know who's an asymptomatic carrier right now of COVID. We don't even know.
And just for the audience, what is an asymptomatic carrier?
An asymptomatic carrier is somebody who shows no symptoms, but actually has the illness and is possibly spreading the virus. I know that your audience is international, but one of the phrases we use is typhoid Mary. You remember American history, there was an individual who had typhoid, didn't realize it spread it all around California.
Right.
Well, we as healthcare workers run the risk of being typhoid Marys and exposing people in our families to what could be for them a lethal illness.
Right.
So an 80-year-old man with atrial fibrillation and cardiac disease, my just going up to visit him to make certain he's taken care of can put the man at risk.
And as individuals, do we carry the same risk? Could we be a similar asymptomatic carrier and carry the disease into our families?
That's one of the scary things about the COVID-19 outbreak, and that's one of the reasons that there's been so much pressure for social distancing and social isolation. The vast majority of individuals who get the illness are going to be fine. The problem is there is a mortality rate of about 1.4% in the figures we have right now. And those folks who are most at risk are folks who are elderly, who have lung or heart disease or immunocompromised. They don't have a really good immune system, maybe cancer patients, maybe HIV. And you never know who has an illness and is being very quiet about it.
Right.
How many folks might be on chemo, but they don't want to tell their friends or colleagues at work because they're proud. They don't want sympathy. But meanwhile, just being around them, you can get them very, very ill.
And so the message that you wanted to talk about was really about the point you just mentioned, which was the social distancing and really the effect of social isolation for those who may have to distance most. And what it sounds from what you said is that there's a special population that really needs to make sure that they stay very far apart from others. And this is the elderly population who may have some underlying health issues. You said some heart disease or other immunocompromised conditions, so their immune system is weak. And for those folks, it seems like maybe the danger goes beyond just COVID into some of the psychological effects of social distancing.
Correct. So I know that a psychological appeal from an ER physician seemed a little bit unusual. You'd expect a psychiatrist to do this, but as I shared with you, this has a personal aspect of it to me. And please also recognize that a lot of other ER physicians, ER nurses, first responders are in the exact same boat. They all have the issues of, let's move beyond the elderly shut-in. Let's move into the person with a child with special needs. Let's move into the paramedic who's got a wife who is postpartum. They're going to end up being fearful of coming home to that woman who just gave birth to their child. And that woman now is completely alone. Because, again, there's a danger for folks visiting this woman of giving COVID-19.
Right.
There's a large community that needs help. But my appeal predominantly, as I shared with you at the start, is more for the elderly who can't embrace technology or are limited in technology skills as far as being able to get some social interaction. A conversation I had with my brother is, well, why don't we just send him a link to Zoom?
And you're speaking now of your 82-year-old father?
Yes. So a lot of us in our age bracket, we're comfortable with technology. We're able to figure out how to make most computers work, know how to use a cell phone, know how to make a conference call with FaceTime or with whatever the equivalent might be.
Right.
I can tell you from personal experience, a lot of the elderly, they are completely baffled and are frightened of technology. So simply saying, hey, let's send a link to a video conference, they are fearful of clicking links because they've learned over time that this could be scams to end up getting their information and to steal from them. There are a lot of scammers out there. A lot of the elderly are frightened to open up email links because they've learned that this is a dangerous activity. Meanwhile, even sending them some of the devices that are out there, such as Facebook has something called a portal, and I think Amazon has something called the Echo, that requires some technological skill to learn how to hook it up to your router. So there is something that requires some brainstorming, which is one of the reasons why I agreed to this interview, because I need your community to brainstorm with good ideas to help out all these elderly folks who are essentially now in lockdown. They are the equivalent of, almost to some degree, being put in isolation.
Yeah. So what I'm hearing from you is that there's a certain population of people who will need to be socially distanced, I think is the term that the WHO uses. WHO, the World Health Organization. But what that ends up meaning is that people feel very isolated. And it seems like the story about your father is that he may be feeling that social isolation right now. And as a medical doctor, not only are you highly exposed, you and of course your other colleagues are probably exposed to COVID and cannot go see these folks. It's the same thing as really members of the civil society. I may be exposed living in New York City, or our listeners may be exposed, and visiting those elderly people who may have immunocompromised positions is very dangerous. So,
absolutely.
So if you were to give a message to young people around the world who right now are struggling to understand how they can help their communities and how they can help these isolated folks, what would that message be?
Well, there's some non-technological ideas that I have, and there's some which is going to require some brainstorming, which I have only some limited ideas. The first one is a lot of your base, I suspect, have lists from their churches or the religious organizations of who belongs to the community and who might be socially isolated. Simply phone calls to ask, how are you doing? Do you need any supplies? Do you have adequate food in the house? Can I do anything for you? And just call on a day-to-day basis so they've got somebody to talk to would go a long, long way. Now, for the same token, that's only one aspect of this. I am somewhat concerned. My father openly admits he's alone. He's in an empty house, and phone calls only go so far. There's no face associated with it. There is no interaction from a more human standpoint. So that's where brainstorming may be necessary. I mean, I had some general ideas, such as maybe Chromebooks that should be distributed, but then you hit the brick wall of, well, somebody needs to know how to get a Chromebook hooked up to that person's browser. Well, most of the elderly I know had somebody like you and me come in there and configure everything for them. We're back to square one. How do you help that elderly person with a Chromebook?
Yeah.
The next idea was there are folks who have emergency phones that are hooked up to cell signals. Perhaps once somebody in your community can figure out a system of getting Chromebooks linked to cell signals. But now we hit another brick wall. A lot of those are going to be associated with costs. A lot of elderly aren't fixed incomes. Where do we go from there?
Right.
So this is going to require some brainstorming because this COVID-19 pandemic is not going to go away by Easter Sunday. And it's probably going to extend easily into late summer or early fall by some predictions. Yeah. So this is something that needs to be worked on, but certainly getting individuals to at least make the phone calls is a first step.
Yeah, thank you. So you heard it here. This is a direct appeal from Dr. Barnett based upon his own experience of social isolation with his own father, that we have a challenge. We have a challenge to make sure that the elderly and the immunocompromised do not feel isolated. We can have simple technological interventions by making phone calls, but the challenge is how do we have a greater face-to-face feel to those digital interventions, and how can we do it at low cost? So that is a challenge for the World Merit community. It's going to be a challenge for communities all around the world. And I want to thank Dr. Barnett for your time. For those who want to follow Dr. Barnett on social media, you can go to his website. I'll ask you for a social media handle in a moment, Dr. Barnett, but first, prior to that, if you want to find out more information about Dr. Barnett, go to his website, which is, I have it here, sorry, it is, sorry, you can jump in, it's
easy, it's literally my name, so it's Jordan, Jordan.
Yeah, thank you.
No space between the first and last name, so it's Jordan Barnett with 2 T's, MD for medicaldoctor.com. So
Okay.
Jordan, BARNETT, MD.com.
Okay.
And on that website, you'll see my Twitter profile and also my LinkedIn profile. I post information right about COVID-19 and what the first responders and EMS personnel and physicians and nurses are learning and contending with. So I invite people to come on board and learn more.
Okay, fantastic. And so you'll see this information on the link that we post on the World Merit website as well. So again, thank you, Dr. Barnett. This was a very valuable call, and we really thank you for your time. And we wish you the best of luck and of energy and support as you go into the front lines of COVID. Thank you.
Well, again, thank you for having me. I greatly appreciate it.
Yeah.
Dr. Fauci, thank you so much for joining us on the Daily Social Distancing Show. How are you?
I'm very well, thank you. Very well.
You are an infectious diseases expert who has advised 6 presidents on everything from SARS to Ebola to the HIV epidemic and Zika. What makes coronavirus so different?
Well, it's different because, when people used to ask me over the years, what is it that I most worry about with regard to emerging infectious diseases, is a respiratory-borne illness that easily spreads from person to person, but that has a high degree of morbidity and mortality. And unfortunately, that's the worst nightmare you could have, is to have something like that. I mean, there are other diseases. Ebola was frightening, but Ebola gets transmitted only when you're in very close contact with a person who is very, very ill. With this disease, in some respects similar to influenza, but in some respects very different, it spreads very easily. You can even spread it when you're not symptomatic. So it's insidious and treacherous in that you could spread it easily. The other part about it that's really so different from anything that we've ever faced before is that if you look at the mortality of seasonal flu, the thing that you and I go through every season, the mortality is about 0.1%. That's a lot. And we get used to that morbidity and mortality. But the mortality of this is about 10 times that. It's at least 1%. So it's a disease that not only is easily spread, but it can be devastating, particularly for a certain subset of the population. Demographically different. The elderly, those with underlying conditions, heart disease, lung disease, diabetes. It can be very serious for them with a high degree of mortality.
Let's talk a little bit about the information in and around corona that's I think getting people confused. I see so many conflicting ideas online, and I guess the horrible byproduct of having social media and the internet is everyone is now an expert and everyone has an opinion. I know this is very basic for you, but just to help everyone be on the same page, how can we catch corona and what are the areas we should be most concerned about? So we know about human-to-human transmission. Most people understand that, but I see people online worried about grocery shopping, touching packages that they receive from Amazon. Do people need to wipe them down? When they're in the grocery store, can they touch other things? How long does coronavirus last in the air? For instance, if you walk into an elevator after somebody else, can coronavirus still be there? What do we need to be on the lookout for as individuals?
Okay, there's varied degrees of risk, Trevor, of that in every respect. But the things that are the most common that you really want to latch onto is that sneezing and coughing. When someone is ill, they've got to get themselves out of circulation because they can spread by droplets and even by what we call aerosol, which means the drop doesn't go down right away. It hangs around for a bit. So you can come into